What about non-steroidal anti-inflammatory drugs? They are the top choice of treatment for people with osteoarthritis because they are effective and non-sedating. Let's answer the question. How do non-steroidal anti-inflammatory drugs actually ease arthritis pain? These medications work by limiting the release of chemicals your body produces called prostaglandins, which promote pain and inflammation. Specifically, almost all non-steroidal anti-inflammatory drugs do this by blocking two enzymes, COX-1 and COX-2, that play a crucial role in making prostaglandins. When fewer prostaglandins are produced, patients experience less inflammation, pain, and swelling. Many non-steroidal anti-inflammatory drugs work similarly to each other, but some people have a better response to one kind of non-steroidal anti-inflammatory drug than another. Two people can take identical non-steroidal anti-inflammatory drugs and doses, and have very different responses. You may need to try one drug for a few weeks, then switch to a different one to find the best non-steroidal anti-inflammatory drug for you. Non-steroidal anti-inflammatory drugs have some side effects, such as stomach irritation, erosion, or ulcer, can lead to stomach bleeding and death. Aspirin is an OTC non-steroidal anti-inflammatory drug that treats pain and inflammation. It can help treat your arthritis symptoms to enhance your quality of life. It works by blocking a certain natural substance in your body to reduce pain and swelling. Side effects of aspirin are upset stomach and heartburn. Ibuprofen is a non-steroidal anti-inflammatory drug available in both OTC and prescription strengths. The FDA recommends taking the smallest dose that works for you and only taking it for up to 10 days. You shouldn't take ibuprofen for longer than 10 days unless prescribed for you. Take ibuprofen by mouth, usually every 4 to 6 hours, with a full glass of water. Do not lie down for at least 10 minutes after taking this drug. If you have stomach upset while taking this medication, take it with food, milk, or an antacid. It may take up to 2 weeks of taking this drug regularly until you get the full benefit in arthritis. Ibuprofen has some side effects, which are upset stomach, nausea, vomiting, headache, diarrhea, constipation, dizziness, or drowsiness may occur. Naproxen sodium is an OTC non-steroidal anti-inflammatory drug. It is used to treat arthritis pain and inflammation. This drug has the advantage that it doesn't carry the same risk of heart attack that ibuprofen does. However, it does have some side effects and include heartburn, stomach pain, nausea, diarrhea, headaches, dizziness, and drowsiness. Take this medication by mouth, usually 2 or 3 times per day, with a full glass of water. Do not lie down for at least 10 minutes after taking this drug. To prevent stomach upset, take this medication with food, milk, or an antacid. It may take up to 2 weeks of taking this drug regularly until you get the full benefit. Duloxetine. It is a selective serotonin reuptake inhibitor. It is used to treat depression. However, it is used off-label to treat chronic pain due to arthritis. Take this medication by mouth, usually 1 or 2 times per day, with or without food. If you have nausea, it may help to take this drug with food. Swallow the capsule. Do not crush or chew the capsule or mix the content with food or liquid. Doing so can release all the drug at once, increasing the risk of side effects. Duloxetine has some side effects such as nausea, dry mouth, constipation, loss of appetite, tiredness, drowsiness, or increased sweating. If any of those effects persist or worsen, please tell your doctor. Dizziness and lightheadedness may occur, especially when you first start or increase your dose of this drug. To reduce the risk, get up slowly when rising from sitting or lying position. Get medical help right away if you develop some of the following symptoms: fast heartbeat, hallucinations, loss of coordination, severe dizziness, severe vomiting diarrhea, twitching muscles, unexplained fever, unusual agitation, or restlessness. Opioids. These prescription pain drugs changes the way you feel pain, but they don't prevent inflammation. They are habit-forming and powerful. They can be combined with other treatments that aren't sedating and habit-forming. Opioids can make you sleepy or impair your balance. This can cause additional concerns for people with mobility problems and arthritis. Doctors often only prescribe opioids if you have a severe arthritis. They may also prescribe them if you are recovering from surgery. Don't drink alcohol while taking these drugs. Opioids can slow your breathing and lower your heart rate and blood pressure. There are other side effects such as constipation, drowsiness, nausea, thought and memory problems, vomiting. It's common to develop a dependence on opioids if you use them for a long time. If you physically depend on a medication, you will have withdrawal symptoms if you stopped using it, like restlessness, muscle and bone pain, insomnia, diarrhea, vomiting, chills with goosebumps, involuntary leg movements. Chondroitin and glucosamine is a combination product that has been used in alternative medicine as a possibly effective aid in treating osteoarthritis pain. Chondroitin and glucosamine is often sold as an herbal supplement. Medicinal use of this product hasn't been approved by the FDA. You shouldn't use this product if you are allergic to chondroitin and glucosamine or if you are taking warfarin. People with diabetes should use caution when taking glucosamine because it may raise blood sugar. People taking blood thinning medication as oral anticoagulants should check with their doctors before taking glucosamine and chondroitin. These arthritis supplements are generally well tolerated. However, side effects can occur. The most commonly reported side effects of glucosamine and chondroitin include nausea, diarrhea or constipation, heartburn, increased intestinal gases. What about the intra-articular injections?